Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
So everybody, we're going to be talking about dental work. You know, people they say, oh, I don't want to go to the dentist, but actually it's not so bad. If you have the right kind of a person, it's not bad at all. And so I think we have the right kind of a person. And you're going to be talking with Estelle Beresford. And Dr. Beresford is a dentist in West Palm Beach, and we're glad that you're here.
Oh, thank you. Thank you for having me.
So, you know, that's always the problem. I don't know if it starts when you're young, little kids say, I don't want to go to the dentist, but I hear it from older people too. What do you think that is?
It's a natural fare. I mean, it's your mouth. It's close to your head. You can't see what we're doing in your mouth. So that's scary for people. It's intimidating. And then there's a technology part of it where they're looking at all this technology. Are you going to put that in my mouth? That looks sharp. Is that going in my mouth? But it's small so that we can get in your mouth. So everything looks small, sharp, and scary, and people are afraid of it. And it's a natural fare. The important thing is finding a dentist that works with your natural fare and makes you feel comfortable.
Yes, and I know when I met you that I'm sure you do that. Well, the big thing, though, is that if people will go for regular checkups, like especially people over 50, 60, should go twice a year, I think.
Absolutely.
Right?
Yes.
Then you're going to find something. So all you're going to be doing are just cleanups. You're just going to do, you know, the refresher. You look at their teeth.
Right.
You clean them. Mm-hmm. And then if you find something occurring, you can take care of it before it gets bad.
Before it becomes a problem. That's absolutely right. It's especially important because as people get older, their teeth still have problems, but they hurt less, which sounds great. I mean, you don't have the dental pain.
They hurt less.
The nerves move down. The nerves will actually move down. But that also means the tooth can have bigger problems before the patient feels it.
I have to
and
tell
that's
you
something people aren't
We have
aware
three
of.
people watching you. We have Dan Winters, Sr., Seth
Hi,
Levy,
Dan.
and Lawrence Lampert. Dr. Lampert.
Hi.
This
Hi.
is great. See, you're on Facebook Live. Well, you're going to have a lot of important things to say. Mm-hmm. So continuing on with your subject, I did not know that as one ages, the pain is less if they have it.
If they have cavities, yes, the pain is less. So it's easier for an older patient to ignore minor cavities or not even feel them or know they're there. So you want to make sure.
Them, is the pain less too?
Actually, yes. Yeah. They're a lot more comfortable patient to work on. They need less medicine, which is interesting. A lot of people aren't aware of that. I've worked with, with the mature community for years. I used to work on a mobile unit and go to nursing homes and work on patients. And that's one of the nice things. Some of them don't even want, like, the injection to get numb. They do fine without it.
Yeah, well, I remember I must have inherited bad, teeth from my family. So when I was 18, I was always in the dentist. When I was 20, I was at the dentist's office. And then over a period of time, I just took very good care of my teeth, except then I had periodontal work done. But once I had that done, it was so painful. I said, okay, I'm going to floss. I'm going to do everything I'm supposed to. And I never have problems anymore. But it took a lot of going to dentist's office to get it. Now, that's my question. Some people, like my husband, he never had dental problems. Is this hereditary?
Yes. There's definitely a genetic component to periodontal disease, even decay, because some people actually have softer teeth than others. Everybody has a different type of bacteria living in their mouth. Bacteria is what causes periodontal disease and decay of the teeth. So depending on how strong, we say virulent, how strong your bacteria are, that can affect how fast your decay progresses, what kind of periodontal diseases you might develop if you're not cleaning as well. So it's different for everybody. Even a husband and a wife, you're living together, you think you share the same bacteria, but you don't share the same genetics. So your husband's teeth may be stronger than yours may be stronger than his.
I'm so glad that you said that. We just have someone else now. Do you want to? There's Eddie Poley on. He's an author, actually. He every wants to come on. And what we do now, we don't let them talk to you, but if they have questions, they've been putting them on here, and then we can just ask you the questions. So,
okay.
So we'll see what they do. But I want to continue with this. I have a son who never had a problem, and my ex-husband had very good teeth. And so I didn't pass that along to him.
Well, that's a good thing.
Well, that's what I was wondering. That's why I was asking you about how that works. But let's just go into when someone comes in and you're going to examine them. You first have to see what you're dealing with.
Right. So we
Do you have to do X-rays?
We do full set of X-rays and an exam, and let them know, because not everybody needs the same kind of cleaning. Some people need more of a cleaning, so I don't automatically go to cleaning unless the patient really wants it.
Really?
Yes, because some people may need deep cleaning. I'm sure your audience has heard of deep cleaning. If you have more buildup on your teeth, you need more cleaning, so that patients aren't surprised by cost. They always know everything up front. I do their exam, figure out what they need done, and then if they still want their cleaning, depending on the kind they need, they can have it that day.
But the most important thing is, I'm sure you educate them on how to brush their teeth, how to use floss, and now I use I have a water pick, and that's been really good, right?
So that's why you're doing so well.
Right.
Yes, my patients do very well with water picks. What happens is, for some people, it's more difficult to clean, especially the back teeth, with floss. If you're starting to get a little arthritis, which everybody does, like about the age 45, 50, you start getting some arthritis, some tightening of the joints. And it's difficult to floss, especially for men who don't have the fine motor skills. Sorry, men. And I recommend a water pick. And when my patients start using the water pick, it's like a lifesaver for someone who can't floss. Right. So it's a good second choice to flossing.
Now, I also have an electric toothbrush.
Mm-hmm.
And is that the best thing to do, too?
Now, my theory on electric toothbrushes
okay.
is good. That people do better, because if I spend $75 on a toothbrush, I'm going to make sure I use it. So it's really how well you reach each area. So electric toothbrushes tend to have a smaller head, and people are able to clean further back, but they're willing to clean with it every day because they just got this $75 toothbrush and they're going to use it. So where they might not brush with their plain old toothbrush, they're going to use, and they do a better job with the electric toothbrush.
Ah, okay. Mm-hmm. So, I do another trick. I'll just tell you this, that 25 years ago, I took yoga, and one of the yoga, and I won't do it here, one of the yoga routines was you put your leg up very high, and you hold that for 100, and then you put your other one up for 100. I've been doing that for 25 years. I have the strongest legs. And also my brushing. That's before I had an electric toothbrush.
Oh, so you do it while you're brushing?
Yes.
Oh, good.
I do it 100 times. That way I'm getting very good brushing. Now I use an electric toothbrush. I just do it until I hear the brush, go to the next routine. But I've really, it's a very important thing for me now, because I spent so much time and effort and money. But and then I will tell you this, that my husband just passed away a year and a half ago at 93, and he hardly had any dental problems. And that was hereditary. The care is important also. I mean, if he didn't take care of his teeth at all, he wouldn't have done so well. He also drank red wine. Could that?
Well, red wine's not bad for you. It causes stains, right. But, it's not bad for you. Right. You just don't want to drink too much of it, maybe.
Right. And we now have Dennis Lerner on also. He's watching. So you've got a nice crew of people watching you.
Oh, that's
on
great.
Facebook Live, right?
Yes.
But let's continue to do this. So, yes, he probably did start cleaning his teeth. He was in the military, and I think they're very forceful about keeping yourself clean and doing everything you're supposed to, right?
Yes, absolutely. They put a big investment. They basically can't deploy people who are not healthy. So your teeth are a big part of that. They were losing soldiers to tooth pain, tooth decay, and before they'll deploy anybody, you have to have a clean dental bill of health. Well, so that's very important.
Well, let's now go into some more serious things. How about, besides just doing that, tell us what else, what other kind of techniques do you do there at West Palm Beach?
Well, I specialize in restorative and cosmetic dentistry.
What is that?
So we do crowns, of course, fillings, exams, fillings, x-rays, crowns, bridge work, veneers, which is facings you put on the teeth to make them look straight and white, or the color that you choose. And let's see, that's pretty much it. We do root canals and extractions as well.
All right, but the people who years ago, we used to see people without a tooth in the front or a gold tooth in the front. We don't do that anymore.
No.
Tell us what your favorite kind of restorative dental work is.
Probably crown and bridge, because it makes such a big difference in a person's life. And it's what crown and bridge is if somebody's missing a tooth, replacing it with a fake tooth that still fits in their smile. It's something that the day that they start, they leave with a tooth in a place that they didn't have a tooth before. So it immediately changes their life. Implants are great. Love implants, but it's a little bit longer process. So it's nice to be able to sit down and give a patient a tooth in the day, and they walk out and they have a tooth that they didn't have before.
And it stays too. I mean, I have a lot of those actually, and
they look beautiful.
Yeah, and they never, they're just the way it is. Unless you bite into a hard carrot or something, you could do something bad. But okay, let's talk about people with dentures, because I'm sure a lot of our population have dentures. So people who have dentures, they come out of their mouth. They're not great. Do you do dentures, or what other process do you do with dentures?
We do dentures. The recommendation now, if you need like a full mouth of dentures, full plates, is to put implants in to help hold them in so that the dentures don't move as much. One of the main complaints with dentures is people know I wear dentures because they click when I talk.
They fall out of their mouth.
Yes, and implants can just help hold them in without being as expensive as an implant holding in each individual tooth, which can be pretty pricey. And when people hear implant, they think of that. If they get implants that just hold a denture in, it's a lot less expensive.
And the dentures, so the
click in, they actually snap in,
so
like
they come out and they go in,
and snap in, so they won't click or fall out while the patient is talking or eating.
That's fairly new, isn't it?
It is.
I think that's a wonderful thing. So people now who have dentures don't really have to have anything else. They can keep them, but they can add the implants.
Right. They'll probably need a new denture for the implants to fit in. I mean, I always tell people there's a chance you'll need new dentures so that they fit properly over the implants, but that's a world of difference going from a complete set of dentures that click, move, fall out. It's embarrassing. So people are happy for them to be stable.
Well, I would tell you a little story about dentures too. I have all these stories I want to share with you. I was very close to my mother, and I knew she had dentures, but I had never, I'd never seen her without her teeth. And when she was very ill and we had to take care of her, of course, we had to take the dentures out. Boy, do people look different without their teeth, don't they?
They do. It's just a big difference.
You can imagine how they feel when they see themselves too. It's as one ages, we try to keep everybody looking good, feeling good, but things like that can really they lose their self-confidence.
Yes. I mean, the first thing you notice about a person, one, is their eyes, and two, is their mouth. You look, you're speaking to a person. If they're speaking to you and they smile, you see those teeth. It's noticeable.
Right.
I've had patients who come to me and say, I don't smile. And they don't show their teeth. And then they get their bridge work done and they're able to smile. 2-3 weeks later, they're smiling and they're grinning, and I have teeth and they look fabulous. And it feels good to be able to provide a service that can impact somebody's life in that way.
My guest is Dr. Estelle Beresford, and she is a dentist, and it's the West Palm Beach Family Dentist, or Family Dentist in West Palm Beach.
You got it. West Palm Beach Family Dentist.
West Palm Beach Family Dentist. And you really do have, it's funny, if I were to look to you and say, they used to have these game shows. Tell me what you think I am. I think that you were a model or you were a singer or somebody. But to have someone look like you and act like you as a dentist. So what made you go to dental school?
I actually, funny story, I wanted to be a psychologist, a clinical psychologist. And that was coming out of high school, and I started taking psychology classes, and I didn't enjoy it. And I was taking a lot of art classes. I work with my hands a lot, also important to dentistry, the fine motor skills. My friend's father, who was in art class with me, says, oh, you girls like to work with your hands and you like science. Think about dentistry. He was a physician. So he's trying to get us not to be physicians because he worked in the city hospital. So he's like,
Right.
no. Think about being a dentist. That way you work for yourself, and because he worked for the hospital. So I went and volunteered at the dental clinic at the college,
what it was, right?
and I loved it. And the rest is history.
Right. And we have Lucy Alacoa watching you also now. We have
Hi,
a lot
Lucy.
of people on here, right?
Okay.
Well, I always ask people why they, were now. And I know if I asked you, do you like it? I think you love it, don't you?
I love it.
How long have you been practicing?
16 years.
Oh, my goodness. You were just a baby when you started.
No, not really.
Well, you're doing well with that. So what I'd like you to just explain to people if they haven't been to a dentist recently, and I am going to give your phone number out here. Let's see. Well, actually, we could do it with your going on. They could go online, but let's just give your phone number. It's 561-642-8501.
Right.
Is that correct?
Mm-hmm.
Okay, and they can go to your website, and I have that also, and that's West Palm Beach.
Dentist.
Oh, West Palm Beach Family. Tell us what your website is, because this is not clear.
www.westpalmbeachfamilydentist.com.
Oh, okay, right. West Palm Beach FamilyDentist.com. So they go to your website, and but they can get in touch with you at your phone number, make an appointment, and I think that if they, and I'm going to talk about second opinions. There are a lot of people that have gone to dentists and they feel they're okay, they've been going, but sometimes you need to go to a different one and just come in and say, look, I've been going to this dentist. Can you check my mouth, and what do you think? And I think that that's important, because sometimes, I do know about dentists who just are doing it. They've been doing it for so long, and for them, it's, they could do it with their eyes closed, but then they don't treat people like they're friends. And I think you do.
We treat them like family. I treat my patients like family.
I know. You have a great assistant.
Oh, they're all
Sharon.
wonderful.
Is it?
Oh, Miss Grace.
Oh, Miss Grace.
Grace and
Miss Grace.
Kaiser. Yeah, they're great. They're
Yeah,
wonderful.
because that's important. That's the person who's going to see you first.
Right.
You're going to see them, rather, and then they're going to, if they're not nice to you, people probably just walk out. But so you do have, the person that with you, I think, has been with you a long time. She was with the practice, wasn't she, before?
The assistant at the front?
Yes.
She's been with me for, 8 years?
Yeah, I knew that, right.
And
she's fabulous. And she
my
loves you.
hygienist for 8 years. Well, 8 years, almost the same amount of time.
That's unusual to keep people this long in your
Wait a minute.
practice.
As a matter of fact, she's been with me longer than that, because she started off first time because we were a startup practice and she was an established hygienist. So she said, I'll come and work a few days for you. And over time, so she's been with me maybe 10 years, maybe, if I really.
Are you aware of how unusual that is? Hygienists come and go. I don't know if you know that.
Not mine.
That's right, not yours. And
Yeah.
hygienists can make the difference. If it's not a hygienist,
She's good.
they won't go to that dentist.
True.
And I know people who love the dentist, but they hate the hygienist, and then they won't go back.
I've heard the other way around too, where they love the hygienist and they'll follow the hygienist wherever she goes.
Oh.
So, yeah.
Well, it's important because sometimes you may not even see them. Now, when the person comes in to have their teeth cleaned, do you also go in and check them and say hello?
Yes.
Yeah, that's really important, because they're there because it's your practice.
Right.
So let's go back on something. So if someone really wants to do a good job on cleaning their teeth, let's start. They wake up in the morning. Tell us what they do when is that the first, besides going to the bathroom, we know they have to do that first.
Well, wake up in the morning. Now, when I was growing up, we'll start with this. We would get up, brush our teeth, get ready, come down to the breakfast table. And, of course, you brush your teeth before you go and greet other people, right? Now, medically, what you're supposed to do is eat first, then brush, then go out. But if you want to be a polite breakfast companion, you can always brush before, but brush after the meal. It's important to brush after the meal.
See, I usually brush before. That's interesting. I don't
Well, that
think
food's
about
going to sit on your
doing
teeth.
that.
Yeah.
You're right. So maybe that's the best thing. If this, anyone listening, did you hear that? So what you can do is, you want to brush first. Some people
Brush
live
after.
alone. They don't have to brush first.
Right.
They just think they have to because it's habit.
Right.
But make
After
sure
the
you
meal.
brush after you eat. And if you have a flosser, maybe you don't brush a second time. Maybe you just use your flosser the second after you eat. Would that be
Better
just
to
as
brush
good?
after you eat.
It's better to brush. Okay, well that'll be a good thing for everyone to do. Okay, now talk about flossing.
You should floss once a day. The best time to floss is before you go to sleep at night. Figure all the food that's gotten caught between your teeth. You want to get it out before you go to sleep. When you go to sleep, you make less saliva. Some people even breathe with their mouth open, and that warm, kind of damp, not rinsing away environment is what bacteria loves. So before you go to sleep, you want to floss all the bacteria away, rinse, of course, brush, floss, rinse, and then go to sleep.
I know people are really getting a lot of this. There's another thing too that I remember I once had. When I sleep, I must grind my teeth. And I have an apparatus that I use. I don't use it all the time. But
guard.
A what?
An occlusal guard, a
It's
bite
right,
guard,
guard.
yeah.
Do you do those
Yes.
for people?
Of course.
And there's something that people have. I never had the pain. They have pain in their jaws.
TMD, it's Temporomandibular Disorder. So it's kind of like having tension in the jaws. Common in people who've had injury to the jaw, maybe a blow to the chin that hurts the jaw.
Or just stress.
Stress even, because stress is like, it's say you have a sore knee. Stress is like running on that sore knee. You're always using your mouth. People think of exercising their legs, moving their arms, but the jaw is, you have muscle, you have the bone. It's just a joint like your knees and your elbows. So if you're working all night, grinding, you're injuring that joint, and you're going to get arthritis more quickly in that joint than if it rests at night. And rest is staying slightly open, and that's what the occlusal guard does. It gives you something to rest on.
And when I had it in my mouth, I didn't even realize it at night. It didn't bother me. Yeah. Do you do a lot of those?
Yes.
And how do you know? Someone
common.
comes in just for an oral examination. Can you tell that they grind their teeth?
Yes, because they actually will wear their own teeth down. The jaws are very strong. I believe it's 300 pounds per square inch pressure that we make. You can crush, I mean, if you think about it, think of the amount of times you see somebody go to open a bottle and they can't with their hands, because they know they're stronger in their jaw, kind of intuitively, so you try to do it. Please don't do that. Do you try to do it with your jaw next? Because the jaw is very strong. So people will, over time, grind their teeth down when they're clenching. And it's actually called bruxism, that grinding and flattening of the teeth. Occlusal guards help save your teeth and the restorations that you put on them.
Yeah, people don't
so
talk
it saves
much
you money
about
over
that.
time.
I think it's very important.
It is important.
We're covering a lot of things here.
Oh, we are.
Yeah,
It's a lot in a short time.
I know you're smart. I know. We don't rehearse these shows ahead of time. You just know if someone's smart, they can handle all of my questions. And then the other question that I have is, how about people who have teeth that have gotten yellow and they're not white? And there are all sorts of things advertised about whitening their teeth. Now, tell us how you whiten teeth, and is it a good idea?
It's fine to whiten intermittently. Let's say your teeth were whiter when you were younger, and now you're looking in and you drink a lot of coffee, you drink tea or that red wine again, and you're seeing little maybe gray or brown. You can whiten, and the best way to do it is in the office, because you'll get the results that you want without injuring your gums or your teeth. Because you don't want to, if you whiten on your own, there is the risk that it can irritate cavities that you don't know you have, or that it can spill over on the gum and burn the gum. Also, if your teeth aren't in line, some of the over-the-counter whitening may not work. And there's some people for whom it would work fine. So if I have a patient in the chair and I know it'll work for them, I'll recommend a brand that they should try. Because it's a lot less expensive, yes, over the counter than in the office.
Okay, but what is it that you can whiten their teeth with?
Well, there are different chemicals that we use to whiten the teeth. One of the common ones now is carbamide peroxide, and it comes with it's akin to hydrogen peroxide. It's close to that, but it's not as sensitive. So hydrogen peroxide can actually burn your gums up. People think, I'll whiten with hydrogen peroxide. No, it's not the kind of thing you want to put in your mouth. Just the ones that we have to use that are for tooth whitening is what you want to use.
And it's like a light, isn't it, when they sit there?
The light actually just warms it up so that the chemical process acts more quickly. So now we have some that you don't even need to use a light with, because the warmth in the mouth makes it work.
And so when someone comes in, is it one time? I mean, how often do they have to come in to have it lightened?
No, one time, and then I'll give them a touch-up kit that fits over their teeth that they can take home and touch up. If they want to do it in the office a year later, that's fine. So it depends on how much coffee and tea you drink.
Yeah, well, so that was my other question. So if you drink coffee or you have wine or you have tea, should you then brush your teeth more, or what can you do? I mean, people still want to have coffee. What do you do if you're going to drink coffee?
You drink your coffee and you whiten when you want to. You're not going to darken right back up immediately. I love coffee, so I know I'm not drinking my coffee through a straw. That's the only way you're going to keep it off your teeth.
Oh, good. I'm glad you brought that up because I do know people drinking coffee and tea through a straw.
That might be why. That might be why. You drink your tea, coffee, colas also stain the teeth. Anything you might imagine would stain a white T-shirt can stain your teeth. So
That's
if you want to
everything.
keep the stain down, drink through a straw. It doesn't get on those surfaces. And yes, brushing immediately after drinking helps keep the stains down.
Well, I think what really is the thing, people won't. How can you really enjoy a cup of coffee without having a cup in your hand?
I don't know. I mean, I enjoy my coffee. I enjoy drinking my coffee.
Right. But that's something. So now I know why they're drinking through a straw.
That's
I had
why.
no idea what that was about. Mm-hmm. But anyway, this has just been wonderful talking to you, Estelle.
here.
And I really appreciate your being here with us, and we'll talk to you again.
Thank you for having me.